New Zealanders are going one step further, in fact, aren't they? They're saying we can't afford basic health care. We've got situations where community leaders are telling us that some people have a sick child, they cannot afford to take that child to a doctor. That's a transport issue. Is that good enough, Paul Adams?
No, it's not. And I think what you've also got to understand is that people cannot afford basic foods anymore either. And that's why the Family Party was the first to bring in the policy of removing GST off our basic and essential food items. Now, 30% of our health issues are diet related. 6% of our deaths were actually through lack of fruit and vegetables. Now, we brought in a policy, which I believe the cost of it would be 51 million, to remove the GST off these basic essential items. Now, when you consider that the people dying because of that is 3 times more than our road toll, and when you also consider that the cost alone of bringing in this new subsidy for the students is something, I've got a figure here, something like 231 million. What is 51 million to remove the GST off basic healthy food items? Because as important it is to have a great health system, to me it's far more important that we have a society where people are kept in good health and do not need to go into the health system. And I think if we can concentrate on that and put things into place that will make that beneficial for New Zealand families. You also asked, how do I work in the community? Well, I'm in a local church that has been working actively in the community for 25 years. We are on the coalface of these issues, and we can see that our families and our country are currently hurting. They are not cash cows to a government. And so we need to address issues that are important to these families so that they can afford to put good, healthy food on the table for their children and look after their children and keep them healthy, which would be the condition of their homes and many other things, heating, fuels. And I think if we go down that road, well, then we will reduce our health budget substantially.
Heather Roy, remove GST off some food items?
No, well, I don't agree with that. I think that that's actually a band-aid solution. The problems that we have with health in this country and many other areas where government spends a lot of money on behalf of taxpayers is that we're not doing well economically. We're not keeping pace with countries we like to consider ourselves to be on the same level as, such as Australia, the United Kingdom. And so the answers there are of very much of an economic nature. We should be striving for greater productivity. We should be striving for greater economic growth so that we lift the standard of living of everybody, particularly those people who are struggling at the moment, finding it difficult to make ends meet. Now, we need to make some really tough decisions in this country after the election if we're going to put that economic growth in place. We're facing an economic crisis worldwide, but there are things that we can do here. Those things do impact absolutely on the health of our nation, but being able to buy fresh fruit and vegetables and healthy food, which is sometimes more expensive than the cheaper stuff, is actually about raising the prosperity of our nation, raising the wealth of everybody, and that's the key, not just tinkering around the edges with things like removing GST on one particular product.
Turning now and looking at maternity care, publicly funded maternity care. This is a question for you, Louisa. We've had a lot of feedback from community leaders who say it's just not good enough. First mothers are going into hospital, they're being encouraged to leave just after a few hours, first-time mothers. And they're just not getting the consistency with midwifery. They might have a different midwife every visit. And staff just haven't got the time of day to look after their needs. What is Labor going to do to help that situation, help alleviate that situation?
Well, we would say we've done a lot, actually. We've been partnering Plunket as a government for a long time now, and I know both National and Labor have a commitment to continuing to fund Plunket. Within Plunket, we have a wellness program, so we definitely know how important it is for our young people to have a good start to life. I think some of the boards that we have within the Ministry of Health around ensuring that mothers are encouraged to breastfeed their children, for example, up until 12 months of age is really important. And so working with industries that provide other alternatives is another commitment that this government has. We have invested more money in midwives. This government will have 80 more places for midwives in terms of next year's budget. So, I mean, we've got to get the conditions right. We've got to encourage people into that particular vocation. I think that there are some critical points in our society. South Auckland is obviously one of them. We've got huge expansion in terms of population growth in South Auckland, and 51% of babies born in South Auckland we know are now Māori or Pacific descent. So there's lots of engagement that we need to do with community organisations, as Paul said, like the churches, who are a huge influence on our people. There's lots more to do. For us, it's all about partnering the community organisations that do provide the grassroots support to our people, and we think that the way we're going, I mean, National and Labour pretty much have a similar policy in this
Louisa,
area.
thank you very much. And now we'll just bring National in, seeing you've mentioned them. Jonathan Coleman, your reply, please.
Well, you're right. There's a huge crisis in maternity care. I mean, women are being turfed out of hospitals, hours after giving birth. We think it's absolutely imperative that women are allowed to stay in hospital till they've established breastfeeding. There's a real crisis in terms of getting midwives into the profession. We've got our voluntary bonding scheme, which is actually going to make it easier for people to train as a midwife and to build a career in that area. We think we have to do much more to retain our health professionals, to encourage doctors back into obstetrics and give women those options so they have more choice in terms of their lead maternity carers. We're going to fully fund Plunkett Line. The government, they're just responding to the political pressure. We've backed Plunkett right from day one. New Zealand mothers tell us that that's what they need, and we are listening to New Zealand mothers and families, and we're going to provide what's right for families and for mothers and children in the whole area of maternity care, because we're going to be focused on actually delivering the results. People are telling us that this is what they need.
Another area, of course, of great concern, Heather Roy, is the elderly. Recent research has shown that the elderly are not so much concerned about the cost of living or tax cuts. They're very, very concerned about waiting lists. What is ACT going to do to help the elderly get better health care faster?
Oh, look, the waiting lists are a huge problem. At the moment, people are being referred back to their GP because they don't meet the government's 6-month criteria for getting treatment. If you don't need it after 6 months, apparently you're not important anymore and you get sent back, and that's just wrong. We need to actually address this problem urgently. We should give people care as soon as they need it, not much further down the track, so that they can get back to an active lifestyle and actually cost the nation less in the long run. What we want to see is much greater cooperation between the public sector and the private sector. The private sector, we know, does have some extra capacity, and we know that it would meet the challenge of filling those gaps that exist in terms of people not being able to access surgery if it had some certainty of contracting. If private hospitals, for example, were given a 2-year contract to do hips and knee replacements, some heart surgery, we know that they would probably go out and build more hospitals. It's about having those services available and accessible. And even if we're talking about public funding, people don't mind where it is that they get their treatment from. They don't mind if they're going to a public hospital or a private hospital, as long as they get that care. Encouraging that cooperation is the key. At the moment, we've got this huge ideological barrier between public and private. As I said before, we should be looking for the best quality services in the best time, at the best cost, no matter where those come from.
Louisa Wald, quickly, one of the questions we've had put to us by the community leaders is, why no funding for families who look after their disabled children?
Oh, no, I think that is an issue, and it is one that we are looking at and reviewing. I personally think that the best people to look after family members who have a disability sometimes are their family members, because they have special needs, obviously, and very intimate needs that only the family will look after appropriately, other than people who are qualified to do so.
So Labour will be addressing that?
Yes, absolutely.
Do you have a timeline on that, please?
No, I mean, I can't say that when that will happen, but it is obviously something that we are reviewing, and it's a policy decision. But I think it needs to be something that's done on a case-by-case basis. In some situations, actually having people who have the skills and expertise to look after people with specific disabilities also has to be an option for families.
National's policy on that, please.
Well, look, you have to look at the fact Labour's had 9 years to sort this out. They're leaving us with a dire economic situation. If we get into government, there's a number of areas we're going to have to look at, but this may be an area which we will have to be open to doing the work on if we get into government.